Hello guys, so this is Mensah, and today's class is about the scope of pathology. The scope of pathology. Now, when we say pathology, it's a medical terminology, alright? It's a medical term. And let's break it into two. Pathology. Pathology. Now, the path there is referring to disease. The logy is referring to the study of something, alright? So the study of disease. The study of disease, pathology. Okay, there are basically two methods or two forms of pathology. All right, to study a disease, there are two ways to do that. That is, it's either you do it clinically or you do it experimentally. All right, so we have clinical pathology and then what? Experimental pathology. All right, clinical pathology and experimental pathology. Now, when we say clinical pathology, it is the study of disease by observation. All right. It is the study of disease by observation. So now, a patient walks into your consulting room with a complaints of joint pain, insomnia, anorexia, all right, headache, fever. These are the complaints of the patient. All right, these are the complaints of the patient. Now, how do you reach to diagnosing the patient? By observation, you are going to do, your examination. So you observe the patient. You do your auscultations, you do your palpations and your percussions, alright? By physical examination, by physically observing the patient, alright, you reach to a diagnosis even before you call out for your labs, alright, or other investigative models, alright? So, or modalities. So, that is what clinical pathology. Clinical pathology, reaching to a diagnosis by observation or studying a disease by observation. Alright. Let's look at experimental pathology. Experimental pathology. So, with experimental pathology, you are dealing with the labs, all right, or better still, the study of animal models and even tissue cultures, all right. So, the study of animal models and even tissue cultures. Basically, experimental pathology is referring to the labs, all right. Your X-rays, your ultrasound scans, your MRIs, your CT scans, your labs like the urine analysis, the stool analysis, or the cultures and sensitivities, all your LFTs, the KFTs, all better to BU and creatine. All these are lab works. All these are experimental observations. All right. So that is that for what? Experimental pathology. That is that for experimental pathology. Now let's look at some subdivisions of pathology. Subdivisions of pathology. So grossly, all right. Grossly, there are about several divisions of pathology. All right. Pathology could be divided into several divisions based on what? Specialties. All right. Based on specialties. But mind you, diseases are of no respect to what? Divisions. All right. So it doesn't really matter. A disease is a disease. So let's look at these subdivisions. All right. I'm going to talk about actually 9 of them. 9 of these subdivisions. So we are going to first talk about histopathology. Histopathology. If you say histopathology, you are referring to the examination of a disease by examining what? Investigation of a disease by examining tissues, body tissues. All right. So investigating a disease by examining body tissues. That's histopathology. Histopathology. Now that is 1. 2. Let's look at cytopathology. Cytopathology. If you say cytopathology, it is just the investigation of a disease by examining isolated tissues. By examining what? Isolated tissues. That is what? Cytopathology. The investigation of a disease by examining isolated tissues. Alright, good. It's a bit related to histopathology, but histopathology is gross. Cytopathology is dealing with isolated tissues. Alright, okay, so that is that. Let's look at immunology. 3. Immunology. The immunology is grossly the study of what? The immune system of an individual. Right? It is the study of the specific defense mechanisms of an individual. Alright? It is the study of the specific defense mechanisms of an individual's system. That is what? Immunology. Let's look at 4. Hematology. If you hear him, you are talking about what? Blood. Alright? And logy is the study. So the study of blood. So basically, hematology is of the concept or the idea of what? Studying disorders that are associated with what? The cellular and the coagulable components of what? Blood. Alright? Studying disorders or conditions that are associated with the cellular and the coagulable components of the blood. Here we are talking about the blood cells and the platelets. Alright? Okay, so that is that for hematology. Let's look at microbiology. 5. Microbiology. So microbiology is the study of what? Infectious diseases and the organisms that causes them. The study of infectious diseases and the organisms that causes them. Alright? So you can get something like tuberculosis. An organism causing tuberculosis is what? Mycobacterium tuberculosis. So that is that. The study of infectious conditions or diseases and the organisms that causes them. That's microbiology. Now 6, we have chemical pathology. So chemical pathology is the study of diseases or the effects of diseases based on what? Chemical changes of what? Body tissues of what? Fluids. So it is the study of a disease based on what? Chemical changes in what? Body fluids and what? Tissues. The study of a disease based on changes in chemical what? Consistency or the chemical changes of what? Body fluids and what? Tissues. So you study, for example, you do your blood chemistries in the lab, those chemistry aspects of examination of the body fluids or even the cultures with tissues with regards to what? Chemical changes. So you studying a disease based on what? Chemical changes of what? Or chemical changes in the body tissues and what? Fluid. That is chemical pathology. Now 7, genetics. Genetics is just the study of what? Abnormalities or disorders of chromosomes and what? Genes. Or it is the study of abnormalities in chromosomes and what? Genes. That's what the genetics division of pathology is about. Alright, that is that. 8. Forensic pathology. So forensic pathology is basically the application of pathology to what? Legal purposes. The application of what? Pathology to legal purposes. So it's just the application of post-mortem to facilitate legal investigations. Alright, so let's say in incidents of poisoning, the patient relatives or the relatives of the expired patients report the incident to the police. Alright, the police will assist the pathologist and the prosecutors, alright, at the morgue to do the what? The post-mortem, just to get ideas about the what? Or findings from what actually killed the patient. Is it a suspected poisoning as it is being reported, or something else, or it was pathological? The death was pathological. The patient was sick, him or herself was sick, and then it killed him or her. Alright, so that is that for forensic pathology. Now 9, toxicology. So toxicology is the study of what? Disease or the effects of disease on an individual in events or incidents of poisoning or suspected exposure to what? Harmful substances. Alright, that is toxicology. Share this video, leave a comment in the comment section, like and subscribe. Alright, bye bye.